Welcome back. Myself, Dr. Padmaja, consultant dermatologist at New Root Skin and Hair Clinic, Hyderabad. Swelling of your forehead and eyelids is a common consequence of hair transplantation surgery seen in more than 90% of the patients. So in this video, I will try to educate you on what are all the possibilities for this swelling to occur and how it can be managed. Firstly, little mild pain and swelling is quite natural and as a part of the inflammatory process seen after any surgical procedure. But if the swelling is severe and it is disturbing you, we need to look into it, why it is occurring and what can be done to tackle it. So let us see now what the common causes for the persistent swelling to occur. Firstly, we infuse large amounts of normal saline into your scalp during the tumescent anesthesia which we give during the process of hair transplantation surgery. So all this fluid, once the surgery is done, all this fluid has to be absorbed into your body through lymphatics and venous channels. So for any reason, if this absorption process is delayed, the swelling can be persistent and disturbing to you. Secondly, your doctor will advise you certain post-op instructions to be followed to ensure all this fluid, subcutaneous fluid, gets absorbed very quickly as quickly as possible. If you do not follow the instructions properly, the swelling can be persistent. Thirdly, if the swelling is associated with any pain or fever, then there is a chance that your subcutaneous tissue got infected, and which is an emergency and which has to be dealt with immediately. So now that we have seen why this swelling occurs, now next let us see what can be done to prevent it. So it is a responsibility of both us, the doctors, and as well as the patient, to take care so that this post-op swelling will be reduced as much as possible. So from our end, we try to give certain pre-op medications before the surgery itself to make this swelling as much low as possible. Also, we perform certain lab investigations to make sure your health is in good condition. Then we try to avoid this non-steroidal anti-inflammatory drugs prior to the surgery. Also, we advise certain instructions to the patient which has to be followed religiously. And from the patient's perspective, what all care you need to take so that these side effects can be reduced as much as possible. You need to avoid excess strenuous exercise post-surgery. The sleep position has to be proper. You need to, on the day of surgery, on that day 1, you need to rest yourself at 45 degrees of angle, and from next day onwards, you need to sleep in straight supine position. You're not supposed to sleep on your sides. Then you are advised to avoid bending the neck forwards. Like for example, while watching the phone or any laptop or any screen or reading a book or newspaper, you need to keep all those things at your eye level. Keep your head straight and look only forward at your eye level. Do not bend your head. This helps in reducing the swelling that usually trickles down from the foreline to the forehead because of gravity. So that is why we advise you to avoid bending of your head. And then also, if after following all these instructions, still if you notice any swelling on your forehead, try to apply the ice pack on your forehead, starting from the center of your head and go towards the temple region sides. This will prevent the swelling trickling down onto your eyelids and sometimes onto your cheeks also. And we also give a tight hair band onto your forehead, which will mechanically prevent the fluid trickling down. So even after following all these instructions and medications properly, even if you still face the persistent swelling, you are always advised to consult your treating doctor, who will advise proper medication for you, anti-inflammatory drugs, to treat the swelling. Thank you.